Morning everyone, Dr. Eric, the fitness physician, where I talk about all things related to hormone optimization, hormonal fitness, muscle medicine, anti-aging, weight loss, fat loss, cellular health, longevity, and much, much more. So I help everyone across the country, especially those over 40, optimize their health, hormones, and metabolism so they can live a life full of strength, energy, and vitality. So I've been doing a little series on testosterone onset of effects because this comes up all the time with my patients and I see it online too. When can I expect to see this? I did multiple videos, so please go back, watch it from the beginning. This is the finale, the last one, kind of the summary. So hopefully you guys enjoyed it and reach out to me with any questions. I had to fix my cord. So basically, bottom line is that things like libido, sexual motivation, psychological effects, mood stability. Is that things like libido, sexual motivation, psychological effects, mood. Things of this nature, the vasculature, which is extremely important, that I've talked about. Usually more of a rapid onset, typically within the first month, right? It can be happen 3 to 6 weeks or more because there's other mechanisms, right? We talked about the nuclear effects, the protein, the translation, the transcription, the translation, how it's more of a genomic, longer term effect, typically with the androgen receptor, but there's other non-androgen, non-genomic methodologies and basically mechanisms for testosterone and the other androgens and all the hormones for that matter. There's genomic effects on the membranes, effect on ion channels. These androgen receptors actually can do a function as well. It's not that the old thought was that it had to be free and not associated with SHBG and these other molecules. That's not true. Other signaling mechanisms. Again, there's some more direct effects that make effects quickly as opposed to the slower effect of the transcription pathway. So again, it's not always a classic androgen receptor. So, and again, a lot of these affect other neurotransmitters and other hormones. So it's kind of a snowball effect, right? So again, fortunately, these happen pretty quickly. Body composition, bone strength, lipids, these are more of a gradual and steady progression, take a little bit longer, especially a lot of my patients, they expect to, I tell them, look, if you're expecting to get a six pack and 20 pounds of muscle in 3 months, it's, 5 weeks, it's not going to happen, right? Even if you're doing everything right, it takes time. It can take, I tell my patients to give it at least a year, and typically more, to really see the ultimate results, but they're going to keep building and getting better and better over time. I've done many videos on studies with men and women, even those who are diabetic and pre-diabetic, and they've had progressive and steady weight loss, and decrease in waist circumference, decrease in visceral adiposity, and over time, consistently, and they've actually reversed diabetes, which is amazing, right? And of course, body composition with muscle, same thing, right? But it takes time. But again, a lot of people see results a lot quicker, especially if they're doing everything I'm telling them in terms of nutrition, fitness, and supplementation, everything else. A lot of my patients start seeing results within a few months, 6 months maybe, but others take longer. But I'd say, again, conservatively, give it a year and see what happens. But again, even after that, it's going to keep continuing. Same with bone strength and lipids. I went over that. Again, insulin resistance, a lot of factors can reflect that, right? So because testosterone decreases lipoprotein lipase, so it's actually reduced with triglyceride uptake, and that can affect the lipids. And again, this is some things you see pretty quickly and others don't. And again, going back to insulin resistance, a lot of other factors can affect this. Again, nutrition, your gut health, your sleep, lifestyle, all these other things, right? So they all have to come and play. A lot of people think, oh yeah, I eat great, I work out great, but most patients don't. I don't. We all mess up. We all have bad days and things can happen, especially with the gut. Things can happen pretty quickly with the gut microbiome, but you can shift it very quickly back if it's thrown off track. So there's a lot of factors that come into play. And again, the last thing was just, we know how these effects are because on the flip side of androgen deprivation therapy, where testosterone has been cut off in these men with prostate cancer, they've had all the flip side, right? They've had increase in cardiovascular disease, increased in insulin resistance, obesity, osteoporosis, and they feel like crap, right? But when you flip it and you give them treatment, you give them testosterone, or you give them, some people are like, what? People who can't have testosterone in the initial phases, we give them estradiol, and this is reversed, and they feel much better, right? So this all is credence to the effects of this. So hope you enjoyed this series. Like it, post a tag, and let me know what else you want to talk about. I'll do more series shortly. I want everyone to have an awesome day. Check out my online site. I'm going to be a lot of changes coming. I'm launching several new programs very shortly. I know I've been talking about this, but there have been a lot of little last minute things I've been doing for my Primax Cellular Nutrition and Fitness course for everyone. And then I'm going to be specifically launching a fat loss course specifically for you ladies out there. It's going to be awesome. And I've got a lot of content on my website, my social media channels, on my website, drericprimax.com. You'll see a lot of freebies, a lot of free information, some PDFs and downloads, and then there's some free stuff or some paid material too, but it's super cheap, right? You won't, we're talking like $7, $8, $10 for some of these PDFs and ebooks. Very cool stuff. So, and more to come. And of course, I'm doing telehealth all across the country. Again, drericprimax.com. Reach out to me, let me know. Everyone have an awesome day. Remember, do something kind and nice for someone today. Pass it forward. Live great. Have an awesome day. Thanks.